Hello students, myself Dr. Maddineni Srinivas, your dermatology faculty in Cerebellum Academy. I hope your preparation is going great. And this is previous year question from dermatology. A patient coming with BT leprosy lesion over the face and you are able to see that there is erythematous annular lesion. Most likely the patient of BT leprosy is in type 1 lepra reaction, and the examiner asking which of the following nerves is most commonly involved in this condition, and the answer is facial nerve. Guys, please remember, among the given options, both trigeminal as well as facial nerves can be affected. But please remember, whenever facial skin lesions are present, then there is a tenfold increase in the risk of facial nerve involvement. The basic funda behind this is, as you all know, the facial nerve has the zygomatous branch which lies superficial over the zygoma, and M. leprae bacilli, it loves to multiply in cooler areas of the skin, and this branch is going to lie very superficial over the skin, so it will be very cool. So that is the reason why the facial nerve is going to be affected more commonly in the facial skin lesions whenever they are present in the leprosy patients, and the patients are going to present with lag of thalmos in this facial nerve involvement. I hope this video is helpful. If you want more such videos, please do hit that like or give a heart. Thank you so much.